Hi, my name is Nicole Japzon, and I'm one of the Neurology Physician Associates at the National Hospital for Neurology and Neurosurgery, or NHN for short, at Queen Square, UCLH. And I'll be doing this presentation with my colleague.
I'm Flordeliza Madriaga. I'm an MS Clinical Nurse Specialist working here with Nicole at NHN as well.
So, our masterclass project is multiple sclerosis relapses and improving patient education. So, why did we pick relapses? Relapse is a major concern for our MS patients, particularly those who are newly diagnosed. And we get a lot of emails and questions because they're worried about their new symptoms. And 85% of our patients have relapsing remitting MS. There's unpredictable nature of when an acute neurological deficit could occur, and also thinking about the potential consequences such as a disability progression. um, Due to this, there's a lot of psychological stress leading up in anticipation of these possible relapses. An article by Katibi shows that understanding the fear of these chronic conditions will help with long-term management of these diseases. So in NHN, we have an email service which is triaged by a clinical nurse specialist, and anyone who's deemed to need an assessment are booking to or urgent access clinic, or UAC for short, for relapse assessment. And they are assessed by one of our medical professionals because, as per NICE guidelines, we aim to treat patients within 14 days of onset of symptoms. So for our data collection, we looked at the patients booked in for the UAC clinic between September 2021 and August 2022. In these 12 months, we identified 184 patients. And now 184 patients, as you can see in our pie chart, 60% of these patients did not require steroid treatment and 30% did. So looking in more detail, those who did not receive steroids, 50 of these patients were identified to have pseudo relapse, which Lisa will discuss in more detail later on. And 57 out of 112 had mild symptoms and were told to watch and monitor, and were also safety net when to come back if it gets worse or doesn't resolve. So the aim of this project is to improve our MS service by educating and empowering our MS patients to understand their symptoms and what next steps do when they are worried about MS relapse. So we were doing this by providing a link and a slideshow, which we will show a taster of later on basically what to do and what to look out for. This will hopefully help to tackle MS patients regarding their relapses by basically supplying a very comprehensible information guidance. And we're giving this to the patients who are newly diagnosed with MS. So I will hand over to Lisa to talk to about the slide she beautifully made.
Yeah. So based from the NICE guidelines, we created the slideshow to support MS patients during their MS relapse. MS relapse is defined by MS Society UK as the appearance of new MS symptoms in an absence of an infection, symptoms lasting in 24 hours, which can affect motor function and restricting usual ability to manage activities of daily living. Symptoms occurrence must pass 30 days since the last relapse. There are two types of relapses, which is the pseudo relapse and the MS relapse. In the slide, it differentiates between the pseudo relapse and MS relapse. NICE suggested factors that can contribute to pseudo relapse, such as infections, heat or cold, stress, tiredness, deconditioning, and periods for women. Management is the wait and see approach or neuropathic pain medication if required. While for MS relapses is steroids 500 milligram for 5 days and considered to discuss early treatment of disease modifying therapies. We also included the 6 ways to lead a brain healthy lifestyle for conservative management.
Thank you. So the slides you made are a lot longer, but we shortened it for this presentation. And and it also highlights what we think that they should do if they're worried about relapse, and very clear guidelines and steps. So in summary, it's important to identify which could be a pseudo relapse, especially if it's an infection, as if we give them steroid treatment, this could potentially precipitate and exacerbate the infection, and it's important to discuss the risk of steroids. In this data, however, the main limitation is that we only gave it to newly diagnosed patients seen in MS education clinic, and there's only 181 patients identified. So there's plenty more patients in our service that have not received this information. And so we can give out further links in education programs in place, possibly daycare clinics, or when they have received disease modifying therapies. A paper by Kopke shows that education programs could give patients more autonomy and help improve relapse management. So for service development, it's very nice to have clear guidance information for patients. As we know from our previous masterclass, a lot of our newly diagnosed MS patients find the initial steps quite overwhelming, so they might not necessarily retain all the information. So it's nice to have something that they can look back into. And potentially, patient education may help improve the efficiency of CNS triage, either by phone or email. And again, further intervention and audio required to see if this helps change or improve the numbers attending the UAC clinic. Overall, we aim for a responsive multiple sclerosis pathway. Thank you very much.
Thank you.